Well, it's nice to have you both here. You both have been great in dealing with CLI patients. And as you all know, CLI is emerging as a big epidemic in this country and in the world. And as you probably are aware as well, here this year at VEITH, many of the breakthrough trials have been discussed at VEITH, and especially the issue of awareness and therapy. So I'll start with you, Dr. Walker. What's your view on CLI and where we are today?
Sure. Well, first off, there's an epidemic of CLI. Populations are aging, diabetes is epidemic, and worldwide there's still a lot of smoking. And these things lead to critical limb ischemia. Obviously, if we're going to have better luck with treating critical limb ischemia, there's several keys. Okay. We have to get to it early, before a wound has gotten infected. The earlier we can reach true critical limb ischemia, where we're dealing with tissue loss, the more apt we are to achieve limb salvage. And how we treat this is critically important. Here at the VEITHsymposium, there are just phenomenal lectures looking at when to use surgery, when to use intervention, what things matter in terms of outcomes long term. Perhaps how could we do a better job screening? And we all know that unlike claudication, where a patient typically with SFN popliteal disease develops pain in the calf with walking, often critical limb ischemia patients either have faulty warning systems because they're diabetic and may feel no symptoms at all, or because there's very little muscle mass distal to the arteries, often don't feel pain. So this is a whole new area, and we have to change the way we think about the disease. And I think the VEITHsymposium has done a great job addressing this.
Craig, that was a great summary. Thank you for sharing that with you. Mark, I want to go to you with a similar question to Craig, but also I want you to sort of mix it with your own views and everything that you've heard here at VEITHsymposium this year so far.
Yeah, I would agree with all of that. I think, critical limb ischemia is obviously a very important issue, something that we deal with quite a bit, but I think all vascular surgeons, deal with CLI, and I think, a meeting like this with the VEITHsymposium, with so many of these talks, getting out the information to those of us that maybe didn't quite pick up on it because it was originally published in a journal that we don't know. This has given me a chance to really get caught up on all the wonderful information that's out there. Learning about drug-coated balloons, drug-eluting stents, new styles of stents that are all improving our outcomes, and also learning about what's happening in other countries that will be coming here soon, and learning about trials that are just getting started in this country, and then other new techniques. I think, distal access, well, I've used a fair bit of distal access nowhere near to the extent of some people around the world. And that's another thing that I'm going to take away from this meeting. I'm going to bring that back home to my partners and to other people locally. And I think that's the beauty of this meeting, is that people can really get caught up to date on all of these new techniques and modifications to existing techniques to better care for these very complex patients.
That's an excellent summary. So you're pretty much summarizing that the VEITHsymposium, not only are they raising the awareness for patient care here in the US, but also globally. So we have a global input on CLI therapy and approach to CLI therapy. Awareness for CLI, we always sort of focus on awareness to physicians, but actually at this day and age, awareness has to be to the public, the patients themselves, and also for their primary care physicians who provide care for them on a daily basis. And then from there, we need awareness for the vascular specialists. If you notice today, VEITHsymposium has a unique feature in terms of attracting all vascular specialties under the same umbrella. So awareness is the key. It seems to me both of your summaries leads to more toward awareness more than anything else.
And I would highlight what you just said about bringing other specialties together, because different people approach things differently, and I think we all learn a lot from each other when we talk together. Sometimes we have disagreements, but I think that's good, because I think it makes us all smarter about how other people are thinking of things and other techniques that we don't know about.
I'm lucky because I've never had any disagreements over my career, but that's not true, of course.
So maybe we can all focus on the patient and what the patient can benefit from vascular specialists, and by raising awareness lead to earlier care lead to less amputation, less mortality. We want to thank you for being here with us today. We want to thank Dr. Veit and the VEITH Symposium for giving us the opportunity to voice the importance of awareness of CLI.